Back in the beginning of 2001, I was graduating from the accredited naturopathic school, Bastyr University in Seattle, known as Harvard of Natural Medicine. And I was moving to the East Coast to do my residency, integrative residency program in Connecticut, because Connecticut is licensed for naturopathic medicine. But I always was seeking more knowledge. I was leaving the West Coast where there were more naturopaths and herbalists, and I really thrived in that environment. And I felt like on the East Coast, there is not that many people who I could learn from. And so I stumbled upon Kelly's protocol. I was always interested in cancer and cancer research, and primarily because it's one of the biggest fear of us, that, and fear is lack of knowledge. So I stumbled upon Dr. Kelly's protocol, and then I was wondering if there's somebody who practices that protocol. That's how I found Dr. Nicholas Gonzalez, and I contacted his office to see if I could do some kind of internship with him. And so they said, yes, write the letter, send it to us, write why you want to do this. So I did, and I was accepted. So I started coming to New York, to his New York office, beautiful office in Manhattan. I really loved it. And I spent a day there once a week, and it was wonderful. I learned so much from Nick. I remember we used to go have lunches together. Me, Dr. Gonzalez, and Dr. Isaacs, sometimes just me and Dr. Gonzalez, and we discussed the cases that I previously saw. He would let me observe patients in the room with him. I remember there was this one woman who came from far away, who had breast cancer. She was sharing her story with me, how she followed everything on the protocol, and she is cancer-free, and she continues to follow the protocol. One of the things that's so wonderful about this protocol, and why I always knew, once I met Dr. Gonzalez, I knew that if I ever needed it, that's the protocol I would choose, is because it just makes sense. It made sense to me 100%. First of all, you start with metabolic type. You determine what the metabolic type the person has, and then you go from there. If you start somebody with the wrong metabolic type, then everything you do just doesn't work. So the metabolic type is like a blueprint for the treatment protocol. Then you have the enzymes for cancer patients, which we already heard from Colin and from Sarper, the principle why enzymes work and how they break the cancer cells. Then there's detoxification. Detoxification is so important because we live in a toxic world, and we are surrounded by this pool of toxins. And it's very important, in order to maintain good health, to go through regular detoxification routines. And we also know how, for example, coffee enemas help with so many conditions, including even psychiatric conditions like bipolar disorder. So when I observed Dr. Gonzalez and I had conversations with him, and I was so impressed by his knowledge, and he always made me feel relaxed and at ease, because to me, knowledge is opposite from fear, so like love is opposite from fear. But when the knowledge is delivered with love, then you lose the fear. So, and that's what Nick was known for. And he knew everything about every subject. And if he didn't know something, he would look it up and get the answer the next day, because he was so passionate about what he did. So I started, when I saw my patients in my practice, I started applying little bits and pieces of the Gonzalez protocol, and I could see the results immediately. At that time, I didn't go through the rigorous training that we put together to become Gonzalez guardians. We didn't have the test in our disposal to determine the metabolic types, but I knew the principles. And so I started seeing some very complicated, complex patients with primarily autoimmune disorders, such as scleroderma. I remember this case of scleroderma. The woman came to me. She was being put on this very dangerous drugs, and she was told if she doesn't go on them, she would die. If you touched her skin, like you literally touched the board. It felt like the board. It wasn't like opposite from soft, right? And so I asked her to do coffee enemas. We changed the diet and some enzymes. And I mean, she turned around completely. I also had patients who had MS, psoriasis, Sjogren's disease, lots of patients with Hashimoto's thyroiditis, and they all benefited just from bits and pieces from the elements of the protocol. And then also Lyme disease. Lyme disease is huge, especially where I practice in Connecticut, and all over the East Coast now, Lyme disease is so huge. And Dr. Gonzalez discovered through just seeing patients, relatives of cancer patients that came to him with Lyme disease, that the protocol works beautifully on patients with Lyme disease. And so it does in my practice as well. And so I always knew that if I ever needed this, I would totally choose this protocol as my treatment option. So in 2015, I had melanoma. It wasn't progressed. It was localized. But at that time, I realized that I gave myself a promise. If I ever needed something like that, I'd go to Dr. Gonzalez for treatment. So I immediately contacted his office because I thought, okay, if my body developed something like melanoma, even though it wasn't progressed, it was very contained, but it means there is something going on in my body that needs to be addressed. So I got on his protocol in 2015, and I was lucky that I was able to see him as a patient because he passed away a few months after that. Mm. But I've been on the protocol ever since, and I love it. I love all the aspects of the protocol. It becomes easy once you know what to do. It's not difficult. It just makes sense, and it's a beautiful thing. So that's my story.